Okay, we're gonna try this again. I don't know what in the world is going on with Facebook Live at the moment. I don't know if too many people are on live or what, but let's try it again. Third time's the charm, isn't that what they say? I don't even know. But we're gonna try this with no video, or excuse me, no slides. I made beautiful slides, but I'll just post this slideshow for y'all to look at later. You look, I said y'all, I'm not even from the South. But I'll post this later, but I'm just going to kind of go through this, and I'm going to go through it from the beginning. So I apologize for those of you who did tune in to watch this from the beginning. But I do just feel like this is super important information. So as flustered as I'm getting with Facebook, let's just attempt this again. And like I said, I'm not going to worry about these beautiful slides that I created for you. I'll just go through my information because I do want you to have the information. That's important. So we'll just do it this way. So again, I am Jenny. I am a nurse, oncology nurse, and I'm proudly wearing my oncology nurse shirt today because it is Nurses Day. Whoop whoop! So happy Nurses Week and Nurses Day to any of my fellow nurses that might be tuning in. So go celebrate you in some way today and this week. So proud of every nurse out there. We rock. And in that, again, so my name is Jenny Daniel. I am the owner of My Nurse at Home. And I want to just, well, first of all, before I even jump in, I want to remind you that this is my opinion, my information. I provide support and education services to my clients. I do try to complement what your provider is telling you. I do not take the place of anything that your medical provider is telling you, advising you, or whatever. I do try to work in conjunction with what they're telling you. I just try to make sure that you fully understand your options and you understand fully the information that's being provided. I really try to work through the emotional piece as well with my clients because I feel like that's very much left out of most of the offices, just probably from a time perspective, we'll say. But any of the information that I give does not ever substitute for what your provider is advising. So today I want to discuss the importance of advocating for yourself when you enter the healthcare system. I talk about this a lot. So for those of you who've seen it previously, seen that I speak about this previously, I apologize, but I cannot encourage this enough. We need to advocate for ourselves. The healthcare system is crazy, and people just get lost in the system. So, again, I like for patients to understand, for you, the patient, you to understand that whether you are the patient or whether you are the friend, family, caregiver, whatever your role is, it's important to ask questions in the healthcare environment. So don't negate the importance of your questions. And, you see a doctor, yes, for a reason, and we know that they have degrees and they're very well educated, but you must understand what you're being told. Every healthcare system, every one of them, has some level of bureaucracy that we all have to deal with. So, those are the rules that we have to kind of work with, the confines of the system. So whether it's related to your health insurance or there's ethics, there's morals, there's all of those different pieces, and at times it can limit the options that are available to a patient. So again, vital to understand what those limitations are and have someone that's on your side who can help without those constraints. So I help the patient and their caregiver understand even more clearly what options they do have because I listen. I sit and I listen to what you as the patient, what you want for yourself, what you wish for your health. But I also provide an objective opinion if you want it. If you don't want my opinion, then I will just listen and I'll help you kind of sift through your information. But I also educate you on what your provider is explaining to you. I want to make sure that you understand the treatments that are being offered by the medical team. I want the medical treatments that are being offered to coincide and align with your wishes. So with knowledge comes power, is what I like to say. Okay. So when we're entering this healthcare maze, as I like to call it, many of our breast cancer or other cancer patients, period, often enter the healthcare system as a person who may have had either little to no experience, or you may have had a lot. I mean, you may have had a lot of healthcare system experience and navigating your way through that healthcare maze, as I like to call it. But if you had little to no experience, it can make it even more confusing, overwhelming, scary, intimidating, frightening, just to name a few of the emotions that you may or may not be experiencing. Most of my clients had nearly no information about their diagnosis prior to their appointment with their surgeon, their surgical oncologist. So they generally receive their call from the radiology team, which is the person who did the biopsy after they find the suspicious area on the mammogram. They're told that they have breast cancer. During that call, or maybe a separate one, they have an appointment to see this doctor at this time in this place, and they're going to give you more information. You may have gotten a little bit of information over the phone, but you generally don't have a lot. So that leaves you as the patient kind of lost. You're feeling like, what just happened? Oh my gosh. Okay, so I just got hit over the head with that. I'm now terrified. I'm freaked out. No idea what's happening or going to happen. You might think that you're going to die, because cancer, many people at some point think they're going to die. Now you're scared, looking for help, looking for information, probably at some point going to turn to the internet, Facebook support groups, maybe your friends, maybe your family, to learn more. But when the healthcare system leaves people, you, for days, waiting to get information, your emotions, those feelings such as loneliness, sadness, fear, anger, they all increase, okay? So some of us will start fighting with the people that are closest to us. We just fly off the handle for no reason. But honestly, inside it's because you're just scared. You're scared of the unknown. You don't know what's happening, right? So you need to be proactive. You need to get prepared to advocate for yourself during this time, which I recognize is hard because you're already like, I don't even know what's going on. So turning to me, I'm able to help my clients deal with the emotions of a new cancer diagnosis, because I too was there a long time ago, but I was there. So I help them to get ready for their appointment. I help them organize the questions they need to ask, and I know what information you need related to your breast cancer diagnosis. So the next screen, which I would have been showing you, is the 6 of the 14 questions that I get to my clients before they go to see this surgical oncologist, right? So there's 14 questions that I keep that are prepared for my breast cancer patients, period. 14 questions. And these are the questions that I want to make sure that you have answers to before you leave that surgical appointment, okay? So after a diagnosis of breast cancer, generally you're going to see that surgical oncologist first. So those 6 questions that I had to put on, that again, I'll post it in a little while. Most of the breast cancer patients and other cancers, honestly, you'll be sent for further testing. That's the first thing to be aware of. So asking what other tests is your first important question to ask. What other tests are they going to do and why, right? We want to know what they're looking for, why they're sending. that's the first question. Then you want to know what type of breast cancer that you have. Is it a ductal cancer? Is it a lobular cancer? Is it an invasive cancer? Is it an inflammatory cancer? What does that pathology report tell them about your cancer? Okay. And then is there anything that might give your doctor an idea that your cancer is anywhere other than in the breast? Important and valid question, right? Then we also, we want to know the size of your cancer, okay? Knowing the size and of the tumor and the grade. The size can help because that's going to talk about what surgical options there are for us. The surgeon may even recommend chemotherapy first because it can be used to treat and shrink your tumor down. And then the grade, that tells the provider how close those cells look like a normal cell or not, and help predict treatments which can work better, as well as how slow or fast the cancer is actually growing. All right. The other thing is the hormone status. Okay. Hormone status will help to tell the doctors which treatments are going to work to treat your breast cancer and help prevent a future recurrence. Okay. Super important, obviously, that we want to prevent a future recurrence. Hormone receptors are proteins that are found in and on breast cells, and they pick up hormone signals telling the cells that they should grow. All right. Now, about 2 out of 3 breast cancers that are diagnosed will test positive for hormone receptors that can promote cancer cells to grow. So knowing what your receptors are is super important. Knowing your surgery options like lumpectomy versus mastectomy. Will they test your lymph nodes when you have surgery? Does the surgeon think that you could benefit from chemotherapy first? Will they recommend you see the medical oncology team first? What complications are possible? How long is recovery expected to take? It's a lot of questions and a lot of information to hear, but an educated patient is the best patient, okay? Important to have somebody with you when you go to your appointment. Spouse, partner, friend, an advocate like me. I even attend by phone the appointments with patients who take a spouse or a partner with them. This way we're all hearing the same information at the same time, okay? This person that goes with you to your appointment, or if I'm on the phone, I'm the designated note taker, okay? Your job as the patient, you're just listening. That's all. Your job is to listen and absorb. Because did you know it takes an average person hearing something 3 times before they understand it? Let me say that again. It takes an average person to hear something 3 times before they understand it. Okay? 3 times. That's a lot. So think about that. You're being told this news, potentially life-altering news, right? At that appointment that you're attending about your cancer. All of the information is being told to you by this doctor who's a stranger. Your world is going to stop the first time you're hearing it. Most likely, they're not repeating it, probably not even a second time, let alone 3 times. You may not even hear any of the information because the information is so devastating. The news is so devastating. This doctor is going to explain everything that they suggest that you do next, which may be a lot of information, before they ever stop to ask you, now do you have any questions? They've laid out your entire proposal for treatment before asking that question. And meanwhile, you're still back here going, I just got diagnosed with cancer. Now what? You're lost, which is why Having support is vital, and why I do what I do. I help to teach my clients what they need to know when entering the healthcare system. I will be on the phone, or if you're local and you desire so, I will be at that appointment with you. Okay, this way we hear all of the information together, then we can go sit down after the appointment and break down the information together. And this way you can have it broken down simply, we can discuss it, make sure that you truly understand what this doctor is proposing for your treatment, okay? And it's different. Everyone's treatment is different. So the person or persons with you, their job is to write down the information. Your focus is on listening. Make sense? If you're alone, no one to help you, you're not really going to learn how to advocate for yourself, nor will you have anyone to turn to when you come home to help you sort through that information. You will be completely overwhelmed if you try to do this yourself. So whatever you decide, please ask the questions, gather the information, take time to sort out and process your feelings about what is happening to you. Okay? Do not feel rushed into making decisions that you are unsure about. Now, I'm not saying take months. Don't mistake in what I'm saying. But make sure that you are comfortable with a surgeon before you go into the operating room with them. Make sure you understand the reason behind chemotherapy, okay? Or if they say that you need more tests, make sure you understand why they're saying that. Why are they sending you for this? Process your emotions. That cancer did not get there overnight. It took time to grow. Understand the how and the why of every procedure and every treatment that your doctor says to you. Please. This is why having me, a private oncology nurse, patient advocate by your side during your breast cancer journey is shown to empower you, okay? It's going to empower you. This is going to increase your education and your knowledge about your cancer. You know, it also improves your outcome and increases treatment adherence when you have the support of someone like me. I really do care about what happens. I am truly passionate about all of my clients and their caregivers understanding the diagnosis and what is going on. What your medical team is telling you, I want you to understand it. I want you to process the emotional side. I want you to go through the emotions of what is happening to you. I want you to be aware that there are people to support you in this journey. I am here to support you during the journey and during survivorship, all the way through. And if you are diagnosed and you are stage 4, we will work through that and we will figure everything out and we will get all the necessary pieces together to give you the best quality of life while you are here. Reach out to me on my social media. Okay, I'm on Instagram, I'm on Facebook, obviously. You can give me a call at 714-696-8773, which spells out My Nurse, 714 My Nurse. Schedule a free call with me. Let's see what's going on in your world. You can go on www.mynurseathome.com. Schedule your free consult there. Whether you need an ally to help out occasionally, a companion to help out on a regular basis, or you need a true partner in this journey, you let me know what you need and I'll be there for you. Thanks for your time and your patience with this today. I apologize for our technical issues. I don't know what's going on. We make the best of it and I appreciate you guys, your support all the time. If there's any questions that are put into the chat, I will certainly address those as they pop in there. And if you're catching this on replay, put in hashtag replay. If you caught this live, put in a comment that's hashtag live. And again, appreciate you. You're beautiful. Have a wonderful, wonderful day. And I will see you next week on our live. All right. You all take care. Bye.